regards to that. So a few months ago, at least a few months ago, a few people got together and, you know, kind of heard enough stories from different moms about their birthing experiences, and some of them were really good and some of them were not so good and some of them were sort of in the middle, and most of them didn't really have an idea as to what was going on with regards to the birth process. So they didn't know what to expect, they didn't know what was you know, the different options that were available, not just simply hospital birth versus home birth, but what the different types of modalities that some people use and choose and so forth. So we created this group called the Broome County Childbirth Advocates, and basically we're just out here trying to educate everybody on all different aspects of the birthing process. Not just birth itself, but pregnancy, prenatal care, birth process, postnatal care, breastfeeding, so forth. It's all free. Anybody can come and listen. The mission of BC Childbirth Advocates is to provide awareness and support and resources for parents, expectant moms, as well as birth providers alike. Because there's a lot of birth providers that don't really know the different options available in our area as well. We strive to educate the community on all available birthing options, procedures, and practices. We look to create a network of professionals who understand the vast array of options available so that ultimately families can have the best possible birth experience of their choice. And that really should be what it is. We're not advocating everyone have a hospital birth. We're not advocating everybody have a home birth or a birthing center or even an unassisted birth. It's really just giving you tools and information to make your own decision, because if you're comfortable as a woman with your body and understand and you're confident in the person that's providing that care, fear just really starts to melt away, and fear is really the main thing that drives down the tracks of intervention. So we're going to want to try and minimize that for you as much as possible. So, I'm Dr. Doug of BC Chiropractic, and we're going to talk about baby positions for a happy and healthy pregnancy. A little bit about me. I specialize, rather my passion is in pregnancies and pediatrics. I do have a degree as Doctor of Chiropractic, but I also took a 2-year course above and beyond that that really zoned in my skills specifically for pregnancies and pediatrics. So my job is to really just make sure that you guys have the absolute best experience with regards to pregnancies, and we can help out in all sorts of ways. We're going to talk about baby position. Now, a lot of people think baby position is head down. Right? There's a lot more to just head down. All right. Any other questions? That's the end of the talk. Just kidding. So these are a few examples of head down position. This is actually what we call the ideal position. It's called the vertex position. I'm going to throw a couple of terms out there because the talk is designed for parents as well as birth providers. So we're going to get a little technical on some things, but we're going to break it down and make it sound really simple. All right. This baby is head down. You notice the chin is tucked. We call that the fetal position. Most people are kind of aware of that with regards to sleeping. And usually we're looking at the baby from the front of mom. So babies like this. The back of the head is something called the occiput. So the occiput is facing the left. We'll talk a little bit more about that in just a second with a different diagram. But that's the ideal. The second position, head down, is called synciput. And it's just a fancy name for where the hair meets the forehead. The next one, you notice the baby's chin is a little bit higher. And they name these by presentation through the cervix, by the way. So the eyebrows of your baby are starting to show first through the cervix. And then we have the more rare presentation, which is called a face presentation. So you can clearly see on this, when the baby's head really tucks down, the occiput and some of the cranial bones kind of fold over one another. So it makes the head much more narrow. Look at that position versus that position. Would you rather that coming down the birth canal or that coming down the birth canal? There's a whole lot of room in the birth canal, right? No. So any little bit helps, and as we can maximize as much of the opening as well as baby's head folding over like it's supposed to, that's going to give you the actual best, fastest, but most uncomplicated birth possible. So they're all head down, but that's the right one. Some other variations are called breech presentations. Breech, basically, there's so many. If you can think of an angle or a position your baby lies in, there's a name for it. So we're not going to go through all of them, but breech presentations are basically anything that's not head down. So here's a complete breech. It's the exact same position, fetal position, only the baby's completely in the opposite direction. This is an incomplete breech. The only thing you notice difference is the leg is straight up as opposed to tucked down in the fetal position. Here's called a frank breech. Probably one of the most difficult breech positions to actually be able to get the baby to turn. Because at this point, baby's bottom is just sitting down in that birth canal. Now, have you ever sat in a hole? How difficult is it to get out of that hole if you don't have at least one leg down there? Really tough, so tough for your baby to get out of that as well. This is called a transverse line, and transverse can be any real direction. If they're sideways, they could be facing front, facing back, slightly angled one way or the other. That's when some people have rib pain and lower pubic pain on the opposite side. It's more of this type of transverse pain. That could be an indicator that your baby's not in the best position with regards to that. And then we have something called fetus posterior presentation. So, the face is pointing out, but posterior is in the back. So anytime you hear positions, OBs or midwives or any birth provider, they're always talking about in reference to the baby's occiput. So, baby's back of the head is facing back, so that's posterior presentation. Here is your ideal position. Baby tucked in the fetal position, scrunched up nice and snug and warm. This is the occiput of the baby. So it's left occiput, and the baby is slightly forward, so that's anterior. So the absolute ideal position is left occiput anterior. That's the way it goes. Mostly because the uterus is nice and balanced and relaxed. You have the liver over here, which is a pretty hard organ. Over here you have some of the softer organs, and then all around baby you have basically your intestines. So there is a bit of things to move around, but if their butt is facing the other way, it's up against that liver, and that's really not all that comfortable. So the baby doesn't normally like to go in that position unless there's something going on. And that's what we're going to talk about, how to find ways to get baby in that right position. Why so many variations? Because it's almost not unlimited, but there are so many different ones. And a lot of it has to come down with basically our structure. I'm a chiropractor. I relate a lot of things to structure, because if the structure is sound, the function of those things that attach to it should be well balanced and working like they're supposed to. So this is a picture of a pelvis from behind. That's the top of the left leg, top of the right leg. There's a triangular bone called the sacrum. And then we have this left pelvis here and this right pelvis there. If you take that pelvis and you flip it around, now we're looking at you from the front and slightly down the birth canal. So now we see left pelvis, right pelvis, and that's the sacrum. Nice and round, big opening. Baby's head could just tip right back down in there. All right, that's the ideal. If there's some shifting, twisting, turning, it takes that nice, beautiful circle and kind of distorts it. Maybe it makes it more like a football shape. And we'll describe how that really impacts ligaments, tendons, and the uterus, and ultimately how your baby lays down. So here's what the uterus kind of looks like. There's that picture that we just looked at, and there's essentially 3 ligaments we're going to talk about. Think of the uterus kind of like a hot air balloon. It looks just like that. And then you have these ligaments that come down and anchor the hot air balloon to the ground so it doesn't float away. Well, the ligaments anchor it to the pelvis. So you have these ones in the front called the round ligaments. Those are those ones that get really tight sometimes. In the morning, you go to get up and whoa, you can only get up here, and you slowly get up and it starts to pull and stretch and so forth. We're going to show you how you can kind of work out some of those things in the morning to help you out with that. So that's the ones in the front. You have this big, large one over here called the broad ligament that wraps around and attaches to part of the pelvis and that triangular bone called the sacrum. And then there was one other one that's not on that. This is the side view. Round ligament, this big old large broad ligament. They had to cut through it and show you this other one called the uterosacral ligament. Don't worry about the big terms or the big names. Just know that your pelvis, your uterus is anchored to your pelvis 6 different positions, 3 different ligaments. So, we're going to take a look and see what the pelvis looks like when it actually starts to move. And it'll give you a little better visual as to why that might start affecting some of the ligaments. All right, so here's that pelvis once again. Left side, right side, triangular sacrum. There's a round ligament that attaches from the uterus to here and the uterus to here. The broad ligament comes around and attaches here and here, and the uterosacral attaches down there and there. So if we take the pelvis and we now shift it, or what we call subluxate it, you can kind of see what happens there. So in this case, mom's hip is tipped a little bit more down on the right versus the left. So it tips down and then it starts to twist and rock back. And when that happens, the pubic bone starts to shear a bit. One side goes up higher versus the other. And obviously you see that sacrum now is tipped off toward the side, twisted quite a bit, plus rocked back. What happens to the spine there? Starts to shift off toward the side. All because we're just standing kind of crooked like this. All right? So if you have that round ligament here versus here, you can imagine that left side now is pulling down on that uterine ligament up on the right. So it's going to get really tense and tight on that left round ligament versus the right. So it pulls the uterus off to the side. But your broad ligament, which kind of looks like this around your uterus, if it tips down this way and the left side rocks back, now it takes that uterus and starts to pull it back this way. And then the lower part in the sacrum here also pulls the uterus this way. So it really gets kind of twisted, torqued, and turned. So if you imagine that nice hot air balloon in that, as that uterus, now all of a sudden, instead of being nice and round, it's more sort of oblong, almost like that football shape. So your baby's most comfortable position normally is head down, because there's room to move around and gravity takes over and the head sits down in the birth canal. But in the case of a twisted, turned uterus, it now comes up and finds the most comfortable position, which many times is like a transverse breech, or this way, or that way, or whatever. So it really comes down to really trying to help balance that pelvic structure. So I'll just let that kind of play through a little bit. You just sort of visualize seeing the pelvis and the uterus and how that kind of interacts with one another. So a quick review. A well-aligned pelvis allows the ligaments, the muscles in the uterus to be balanced. A balanced uterus allows your baby to get into the most comfortable and ideal position, which we now know is head down only. No, we know it's left occiput, slightly anterior. And what does that mean? Both of them makes a very happy mommy and baby, because that's what it's really all about. So here's what the birth process looks like. And I'm going to show you another couple of slides, but we're going to walk through this one. Baby is head down. Mom's on her back for this particular slide. That's how almost all the instructional videos and everything are on that. We're going to talk a little bit about why maybe we could try a different position, which would be better. But on the back, typically legs up, it's called the lithotomy position. So left occiput anterior. This is mom's spine. Baby crunches down, a little more vertex position. The back occiput leads the way because right about here, the cranial bones start to fold over one another. Makes it squeeze a little bit more. So there you can really see the diameter is much more narrow versus if it was a face presentation. Wow, what a big difference. So baby's head now turns. You'll notice that the face is facing the tailbone. In a posterior presentation, it's the complete opposite. Much more difficult for baby to get through, much more uncomfortable for mom to have that birth too. So as the baby's head now comes through, we go into extension. The baby's neck now rests on the back, on the pubic bone, and the head is allowed to come out. Once the head's out, the baby turns his head. Once the baby turns the head, the shoulders will slowly start to follow. The vagina goes this way, not this way. So to come out, the shoulders want to go the lengthwise. Pretty obvious with that one. But it takes time. The first shoulder comes out, and then with another contraction or two, the second shoulder comes out, and once the shoulders come out, it should be pretty easy from that point on. What we kind of see is that people get really impatient between here, here, and here. So, moms, birth providers, docs, OB, whoever, all right, give it some time. baby will get into that right position and be able to dislodge. So, I'm going to show you the birth process. It's a virtual reality one. It's a really cool site. I don't know if anybody's ever seen the videos on this site. Have you seen Birth Center?
Yeah, I looked at the videos.
Pretty amazing animations. They actually go through everything from conception all the way through every single week developmentally, through the birth and after. They also do breastfeeding ones, all animated. So we're going to show you what this looks like.
In the weeks before birth, your body slows down production of the hormone progesterone while increasing production of other hormones, including prostaglandins, which soften the cervix, and oxytocin, which triggers the uterine muscles to contract. True labor contractions are rhythmic and painful and grow consistently stronger. As the long vertical muscle bands of the uterus tighten, they pull the cervix open. The strong muscles at the top of the uterus push down and release, guiding your baby toward the cervix. The mucus plug, a collection of thickened cervical mucus that sealed your cervix shut for 9 months, may be expelled days before or in the midst of labor. When the amniotic sac ruptures, your water has broken. It can feel like a trickle or a gush of fluid. Your cervix will begin opening and thinning, known as dilation and effacement. Once you reach about 4 centimeters, your body will move into active labor. In active labor, contractions become stronger and closer together. At 8 centimeters, you enter what many consider the most painful part of labor, transition. By 10 centimeters, you're fully dilated and may feel the urge to push. This is your signal that the second stage of labor has begun. Your baby will move down with each contraction. The 3 separate soft bones of his head will temporarily overlap so he can pass through the snug birth canal. Your baby's scalp will come into view. When the widest part of his head is visible, your baby is crowning. With several more pushes, your baby's face, shoulders, and body will emerge. In the third and final stage of labor, your placenta detaches and is expelled. With your baby's first breath, the incredible journey of birth is complete.
I think it's a pretty nice visual.
Yeah, and I really like that she was holding the baby, and they hadn't even worried about cutting the cord yet. I really like that video.
Sure, and there's skin-to-skin contact, which there's a lot to say for skin-to-skin contact as well. I want to slap those hands, get those hands off that baby's head. That's one of my biggest complaints about the birth process itself. So I want to show you the exact same picture, only in two different positions. So this was the last one when we said the second shoulder is free. So here's mom on her back, birth canal comes down, but then what happens? That baby's got to get up and out. All right. Use gravity as your friend. Put gravity on the payroll, as I like to tell people. You know, because gravity's going to be there 100% of the time, whether you use it or not. You could go against gravity. Is it easier to push things up against gravity, or sort of just let them roll down on their own? Much easier to let gravity assist you with this. So in this case, your baby has to be pushed up, your uterus contracts and tries to birth your baby up against it. This is the position with mom more upright. So whether she's in a full deep squat position, whether she's in hands and knees, tipping back, whether you're on a birthing chair, a ball, or whatever, gravity is really assisting tremendously in letting your baby come on out. So there's little to no tugging or pulling on the head, at least there shouldn't be, because all the doctor's got to do, or the midwife or your husband, who's ever there, is just literally got to catch your baby and let them come out naturally. All right? Every single instructional video that I see, and I've seen quite a lot of instructional videos, shows a lot of pulling and tugging. And the narrator is always saying, watch out for the shoulder. You got to free up that shoulder. Don't want any shoulder injuries, brachial plexus injuries, and so forth. So they do everything they can to kind of free up that shoulder and dislodge it. But nobody ever talks about the head or the neck. Now when your baby's born and you're holding your brand new little baby, how does that head neck look? Is it strong, looking around? No, I mean, you pass it and it's almost like, okay, oh my gosh. You know, do you ever worry about injuring the shoulder, or are you always concerned about that head and neck? Okay, so because it's so extremely delicate, so any amount of tugging or pulling can actually start to affect the way that cervical spine is. So my next slide is, don't pull on the head. Just talk to your birth provider. Say, listen, you know, I really don't want any pulling as much as possible on the head and neck because I'm just concerned about the structure of the baby's neck or spine. And they should be like, okay, no problem. There are a couple of pictures. These are normal, average, considered pretty average deliveries, except for the third one over here, which is unfortunately sometimes there's a need for forceps. But you know, here's a baby coming through, and that's pretty common to pull up there, and that's pretty kind of common to pull up and turn a bit, and then the forceps, unfortunately, sometimes this would actually be more of a cesarean. A lot of parents ask me sometimes, you know, it wasn't too traumatic because I had a cesarean section, all right, but really what happens is there's no uterus pushing through to push that baby up. So the doctor makes as small an incision as possible and reaches in, and many times it's the head, or sometimes it's an arm, or sometimes it's a leg, but usually they try and deliver them head first. But again, you have nothing pushing against, so it's all traction. So it's not unrealistic to understand why Dr. Tobin of the Harvard Medical School's pathology department goes on the record as stating that the birth process under normal conditions can be potentially traumatic, crippling event. It's estimated, or spinal cord and brainstem injuries occur often during the process of birth, but frequently escape diagnosis. One of the cardinal signs is respiratory distress of some sort. Your respiratory centers are located in your brainstem. So if baby's having some challenges breathing, especially if they have to kind of rush over here and do some resuscitation, that's a sign that there was some real significant damage that could have been done with regards to the upper cervical area. He actually went on to say about 80% of births actually have quite a bit of some type of cervical damage on that. So just, again, be real cautious. Listen, doc, midwife, you know, just let baby come out. Let's just have some patience. Let those shoulders turn on their own, because 99% of the time they will. We just sort of have to sit on our hands for just a little bit. Upright gravity will assist that much, much better. It's common to stretch an infant's neck more than 1.5 times its normal length during what's considered normal delivery. Just how fragile that neck is, I mean, you can just imagine it's easy to just put a little bit of traction to stretch a baby's neck, but now if you're doing a lot of pulling and turning to really get it, you can kind of relate a little bit more as to why that would be that way. So that's the only sort of, ooh, I didn't like those pictures, all right? But I got to make it real, and I just want to say, listen, it's serious, because I do see a lot of babies in our office, and that's the most common thing is upper cervical tight misalignments. So any questions on the biomechanics, baby position, birth process, anything like that? All right, if it starts beeping, you know what to do. So, as a chiropractor, one of my biggest contributions to the birth process is trying to keep that pelvis balanced. Hopefully you kind of understand the difference, or the reason why a nice balanced pelvis can affect the birth process. So we use what's called a Webster Technique. Webster Technique addresses the pelvis, the muscles, as well as some of the ligaments. So the first part of the Webster Technique is basically me just getting in there and checking mom's pelvis and hips and making sure that they're pretty much square, not rotated where they're supposed to be. When we check that, we also check a couple of the piriformis muscles and some of the ligaments, like that uterosacral ligament, to make sure that if it did shift off to the side, we want to relax it so it can kind of come back in more. Then we turn mom over. Oh, and by the way, she's probably about 35 or 36 weeks right now. Our table drops way out low so that her baby can just rest right in there. I don't know how often you get to lay on your stomach as a pregnant woman.
Yeah.
Not too often, but it's really comfortable just to come on. Sometimes they're like, you know, pregnant women are like, can I just come in all the time? That's all right, come on in, we're closed from 12 to 3, just have a nap, that's fine. So after that, mom turns over and we're just palpating along those round ligaments, which are from here to the uterus, right around down into the pubic region. So we feel for one side that might be tense or tight versus the other. And we just do what's called the trigger point. We just line up on the most taut spot, hold and compress it. And it's usually very comfortable. It's not like when you push on a muscle spasm, it hurts, but it just starts to release it. Sometimes I only have to hold for about 30 seconds, sometimes 2 minutes or more. It just depends on how tight things are down there. And there's a couple other light little things we do, and that's it. That's the Webster technique. Square the pelvis, relax the muscles and ligaments surrounding and supporting the uterus, and that will allow the uterus to expand to its nice fullest potential. Gravity takes over, baby's head settles right down the birth canal, usually shifts right around because the liver's sort of pushing down this way, and baby gets the head on the left side over here. Kind of makes sense?
Mm-hmm.
Okay.
Now, is that something you would do just for a normal, you know, if everything's going well, or is that only if the mother is feeling discomfort? And
What do you think?
I would think that it was only if she's not feeling well, or, you know, something's...
I would recommend absolutely throughout pregnancy, whether you're feeling well or not, because we're only talking specifically about ideal baby position. I have other presentations that we do which shows what other things happen, but there's a whole neurology associated with the adjustment, the different nerve supplies to the uterus and the cervix. It's not just for comfort on mom's part, but there's also, I mean, it helps prevent baby from getting in an abnormal position. Yes, you can have less pain and discomforts throughout pregnancy. It also shortens labor times, shortens the birth process, decreases the amount of potential complications and interventions. Because even if the pelvis isn't squared and perfectly aligned, your baby might be in the ideal position, but the birth canal might be a bit shifted or not as open as it could be. Or the tailbone might be scooped under and the coccyx is preventing the baby's head from descending more. I'm going to show you a slide on that in a second. So, yes, it can help baby get into a good position, but it really, the power of Webster is to balance everything so that it opens the birth canal and allows basically an uneventful birth process. So, does that answer your question?
Yeah, so, I mean, you would have, I mean, ideally you would have a mother come in ever, like, from early on in the pregnancy and do this periodically, or would it just be, like, towards the end, like the third trimester, or what would...
I think everybody should be going to a chiropractor fairly regularly to begin with, whether you're pregnant or not, because it helps out with the overall health and wellness. But when you're pregnant, yeah, you would definitely want to try and get in some type of regular care to get in there. It depends how often you would need to be seen. If someone comes in and you know they have a curvature of the spine and they're really twisted and turned, they're going to need to be seen a lot more frequently to get them into the ideal position and then maintain it. Some people come in and they're actually quite flexible. They need a little bit of tweaking, do a few frequent adjustments up front, and then go weekly or every couple of weeks thereafter. So it just kind of depends on what happens. If someone comes into me at 36 weeks and there's a lot going on, yeah, we got to see them a couple times a week at least to try and get the pelvis squared and ready for birth. Okay. So, posture. What things that you can do outside of the chiropractor's office? Whole lot of things. Posture's a big one. You want to try, hopefully now you got, with all these videos that we've been looking at, you want a nice square balanced pelvis. So, all you multi-moms, yeah, well, I gotta
Just
carry my baby on my hip like this, or you know, shift in this way, or however you want to hold them, and I gotta use my left because my right arm is what I do everything with. I write with this, I pick up, I do laundry with this, I do everything. So, ideally, you think that's really good for the hips and pelvis. Probably not. I'm not telling you to put your baby down. We're attachment parenting ourselves. You can get a baby carrier. Some of them shifted off to the side, in which case it still creates that.
Yeah.
Some are in front, but if you're pregnant, probably not the best position for the other baby to be in. But try and switch it up, okay? You know, you may have to do some of the things like this, but whenever you can, shift it over here, okay? It's okay to shift back and forth. Nobody walks around like this.
I don't know how you can't shift the baby back and forth when they're on one hip.
Some people, you know, that's it. They
That's
walk
great.
in, they come down my hall.
I'm
like, hey, how you doing? Okay, you feel pretty straight? Yeah, why? Well, this arm's touching your thigh here, and this is hanging way out. So, you know, those are some things you can kind of look for. But you're going to want to shift your hips and pelvis back and forth as best you can. Okay, we just covered all that in that one. Laying down. Some people say you got to lay on your right side because the heart's on the left side. You don't want to stress it out that much. I don't really think so. You know, heart is mostly in the center. During the birth process, it does tip up a little bit. But really, baby's back wants to be along the left side. It's the heaviest portion outside of the head. So if you lay on your left side, babies can many times sort of turn and get into that ideal position just by simply laying and letting gravity work. Gravity, I've said that many times now. Use gravity, think about it. But nobody sits in one position for too long, and your baby wants to kind of move and shift around too. So go left side, go right side, do whatever you can. When you're on the side, I know I've seen lots of pictures, you know, you got your 17 pillows piled all over, and you kind of one of these and one of these and whatever you're doing. The more we lift up and turn, what's going on with the hips and pelvis? I'm exaggerating, but it's twisting and torquing.
Exactly how
So
I sleep.
it's not the best position. Side lying, pillow between the knees, keeps the thighs, hips, and pelvis pretty square. It's okay to shift a little here and shift a little there. You want movement in those hips and pelvic muscles, as well as the joints. But try not to do same thing, same position all the time. In the morning, for those really tight round ligaments, start out by laying on your back. Yes, on your back, even though you're pregnant. Bend up your knees a little bit and just gently massage the length of that round ligament as best you can. It goes from up here to the pubic region there on a slight angle. So just get in there, massage them down. Circular ones are a little uncomfortable because now you sort of, if this is the ligament and you circle around it, you kind of pluck it like a guitar string. That's not the most comfortable. If you can get in along the fiber and start to work the fiber down toward that pubic region, that can really help to loosen up some of those ligaments. And then when you go to step out and you get out, it actually should be a lot more comfortable. So take 1 to 2 minutes in the morning just to kind of do that. And when you bend your knees up, it relaxes it a little more so you can kind of get in there a little bit deeper to get to the ligaments. Because they're under a couple of muscles and you want to try and get through the muscle first. Sitting. Ideally, you do not want to slouch. Amy, can you grab me a chair that's in there? It's got a silver backing? Yeah. So slouching, you have this tailbone down in here. So if we sort of scooch forward, opens up to allow baby to kind of hang out here, but you end up rocking back on that tailbone. And that tailbone will, I knew there's a reason why you brought this. So if you sit on the side and you're upright, see how the tailbone doesn't even touch? But now we scooch forward and we slouch, and what happens to that tailbone? Yeah, now it's making contact. And the tailbone moves. So if you sit on it, that little coccyx can now tip a little bit forward, cause some of that tailbone pain that a lot of people can experience. But what that also does is if you tip the tailbone, now you've just made the pelvic outlet even smaller. And every little millimeter, forget about inches, every little millimeter counts when it comes to a nice, open birth process. Got it? Okay, good. So that's part of the sitting posture. You want to sit more upright. Ideally, you want to try and have your knees a little bit lower than your hips and pelvis. Open up. Baby sort of hangs out there, almost like a hammock sort of swaying. If it's up like this, pushing up here, your baby will sit back more on your spine, be a little bit more scrunched in there. But if you're more forward, tipping out, there's more room for the baby to move around. Gravity is pulling the head down. They can corkscrew down into that birth canal like they're supposed to. Plus your lower back is arched a bit, your tailbone comes off, opens up the pelvic cavity, and that's just a little bit more room for them to descend as well. Use an exercise ball or a Swedish chair. Anybody know what a Swedish chair is?
No.
You know, years ago, they came out with this one where the part where you sit is angled like this, and then there's a place for you to kneel down like that. Does anybody remember those things?
Yes.
All right, well, you sort of sat like this, and then there was a pad here to sit on that. I mean, that just really puts you in the ideal position. If you have a Swedish chair, go for it. Most people don't have a Swedish chair. I wouldn't ask you to have anyone build it because it probably wouldn't be too stable. But you can use an exercise ball to do something very similar. So you don't want to sit on
They're so amazing too.
The
They're so
exercise
much more
ball?
comfortable.
So with an exercise ball, you want to start off like this. You want to scooch back a bit, get your heels under, and then roll forward. And what that does is it puts your knees a little bit below your hips and pelvis, opens them up, and just forces you to sit in the upright position. So one, it's going to be the most comfortable biomechanically for the hips, pelvis, and lower spine, but two, there's no backrest. So you're going to have to actually use some of your postural muscles to sit in this upright position. But I would definitely do what I just showed you there. Start with this, you got to wedge your heels into it, and then lean forward, because that's going to stabilize it tremendously. If you just sort of go forward like this, you know, it's not going to work. So your legs, for one, your knees aren't lower than your hips and pelvis, but two, I'm firing off my thigh muscles right now to hold me in there. So, boom, boom, lean forward, opens up, back just settles right in there. Super comfortable, even if you're not pregnant. Use an exercise ball to kind of sit around. Sit backward on a chair. Baby sits there. Again, knees are below the hips and pelvis. You know, sometimes it's a little exhausting being pregnant. You know?
No.
Yeah. Someone could rub your back. Absolutely. Everything. Tailbone comes up. You know, get in there, start to relax some of those muscles. And just sort of, you can relax this way, whatever's most comfortable for you. But that's a really good position if you don't have an exercise ball or anything else. There it is. Exercise, the piriformis stretch. One of the first slides I showed you was the pelvis from behind, and there was a muscle on the right, muscle on the left. Well, it's a muscle that attaches your sacrum to your legs. And basically it allows your leg to kind of move, rotate in and out like that. So to stretch it, you just do exactly what she's doing here. There's a lot of different positions you could do with the piriformis stretch. When you're pregnant, you're a little bit limited. She's got a baby in front. So you sit on the edge of a chair. You do as best you can to cross that leg. Woo! Sometimes that's it. Maybe you want to straighten your leg so it's a little bit lower. But ideally, try and get it so that the ankle is about the same height as your hip on that side, and you just want to simply push that knee down. You should feel a very nice pull and a stretch in there. The ideal is to be able to lean over your ankle while you hold that knee down as well. But when you're 32, 35, 38 weeks pregnant, there's not a lot of leaning forward, plus it makes it a little tough to breathe. So just sit straight up like you see her doing in that picture there. Try and get that shin as best you can parallel. I'll guarantee you if you do one side and then you do the other, you'll be like, whoa! One side is almost always much more stiff and tight than the other because of things like that. Okay, so that's a good cue that things aren't really all that well balanced too. So try and get in there and try and loosen up some of those muscles. Imaginary stairs and figure eights. So, hands against the wall. It's like you're getting arrested. Everybody can relate to that, right? What's next? Of course. So, back of a chair or whatever, just pretend you're going upstairs without lifting your feet up. So you just want to lift one hip and pelvis, hold for a second, down. Other, down. Just back and forth. You'll probably notice that one is not quite going up as easily as the other, or maybe not as high. Try and work through that. Because that's telling us, you kind of saw that video when it showed the rotation of the hips. Well, shifting up should allow that pelvis to tip like that as well. If it's not tipping well to one side, it's not as symmetrical and balanced. So just kind of work through that, hold it a little bit longer, go a little higher, back and forth, back and forth. Once you get that to balance out, then you can add, and I'm not a hula dancer, so it's a little tough for me to get the hips moving in a figure eight position, but instead of just lifting it up, now it's lift with a little bit of a turn, shift, lift, turn. I just actually felt a little release in my pelvis there, so I was a little fixated. And then go the other way. So you just want to get good movement and flexibility within that pelvic girdle. Squats. Whew! I showed that picture to Shauna, my wife. She's like, that doesn't look very comfortable. I said, well, it's not the most comfortable, but really, you want to just get in there. She's doing it with an exercise ball. That's great. Open up those knees, squat down low, stay more upright. That's going to open up a whole bunch of things. One, it stretches the perineum, which is some of the soft tissue between the anus and the vagina. So you want that nice and flexible to be able to open up. Second thing, it strengthens the legs. Third, most important perhaps for the birth process, is it increases that pelvic outlet by up to 10%. That's huge.
Especially for women who are told they have a small pelvis.
Exactly. So it can really open up that region. I'll show you a quick picture right after, and then I'm done with my part. But it also shortens the depth of the birth canal. Wow. So my baby doesn't have to travel as far down? Yeah. You know, the birth process we went through, it was a 2-minute video. Obviously the process takes a little more than 2 minutes. But you know, if it's a 3-hour, 5-hour, maybe it's a 2-hour, maybe it's a 12-hour, I don't know, and even more. But if you can take the birth canal that's this big and now make it, it's not going to be that big, but you just shorten a little bit, that little bit can really make all the difference in a whole bunch of things. Also, I would suggest not trying that on the day you're delivering. Just saying, you know what, Dr. Doug said I should try some squats, so you know, the birth is coming, let me start doing some squats. That would be like saying, hey everybody, let's go run a marathon tomorrow without training for it. You probably wouldn't make it through the marathon. If you did, you'd be, I don't know what you'd look like. So you need to really kind of train and strengthen those squats, because you'll want to do this throughout the labor as best you can. Again, to stretch, open, get things shifted and moving around. I couldn't download the video, it wouldn't let me on this one, but basically this is what the pelvis looks like, the pelvic opening outlet looks like from the side when someone's standing upright. And then when there's a gravitational force going down and up, like a squatting position, this is what happens here. Look at the difference between where the tailbone is and part of the pelvis versus there. Wow, that's a real big difference. Now sometimes when you're in lithotomy position on your back, they'll take those legs and bring them up and try and put them next to your ears. All right, not really good for the for the hip muscles, definitely not for the SI joints. But you don't have any compressive force pushing down on your spine like gravity would, so you don't get this tailbone to tip out like that. You might get a little bit of movement up this way, but you completely miss out on that opening up. So there's no way you can get that 10%. You probably, I didn't get any literature on this, but my biomechanical brain says probably, I don't know, 2 or 3%, maybe increase in that. So much, much better. Did I emphasize yet the importance of gravity? Is everybody picking up on that? Okay. So try as best you can to get into some of those positions, and that's something that any of the doulas or anything like that can certainly educate you more on that stuff. Any questions?
I've been doing some squats, but I've been doing ones where my feet have just been forward and like sitting back in a chair, but you would do the ones where you point out, more the
Sitting
ballet.
back in a chair.
Like, you know, you just keep your feet forward and you just come back like you were just gonna sit in a
Okay,
chair.
so not really sitting in a chair.
Right, but like you were spinning, not instead of like
It depends where your
leaning
knees are
forward,
going.
you just come back.
That's not bad.
You know, like the,
You just want to
rather
make
than
sure that
fit-
when you're bending your knees, that your thigh goes over wherever your feet are. So when people are doing squats in the gym and their feet are facing forward, it's like this. You're not going to get a lot of squat like that. You
So
gotta
it's better
kinda
to
open
do
up.
point out.
Not like that far.
Okay, just a little.
Yeah, just I would say about 45 degrees.
Okay.
And then when you come down, it's that.
Okay.
Ideally, you want to come down, I mean, if you can keep your heels on the floor, not a lot of people can do that, but that would be the ideal. Sometimes we get on the balls of our feet, and it's a little different. You'll actually burn out your calf muscles pretty quick doing that, but really try and just sort of sit down into it, and then come back up. And I would certainly use, like what you saw with that, some sort of stability up
Yeah, I
front.
usually have a chair.
So you're not shifting too far one way or the other.
And in the hospital, if you want to deliver in the squatting position, they have squat bars that can attach to the bed, and you can lean on that and squat down so you're not
Okay.
in labor
Grab onto 'em.
pushing.
Pull, all sorts of things. Any other questions?
No, it all sounds good, but we're actually going through it.
Exactly, and thanks for actually mentioning that, Megan, because we went over ideal. I mean, how often does ideal happen?
Not very.
It can, it just
Yeah.
depends on how things are shifting there. Everybody's unique, everybody's individual. You know, it might not happen exactly in that order in the way it's supposed to be. But, I mean, your pelvis might have a little asymmetry with some of the bony growth one way versus the other. So maybe the baby's got to kind of shift a little bit. Maybe it's not quite left occiput anterior. Maybe it's a slight posterior. Or maybe it's almost totally anterior. Whatever. But you got to have that faith in your body's own innate inborn wisdom, because we're designed to birth. You're designed, excuse me, not wait. I'm one of the gals here, you know, it's just me and the gals. You're designed to birth. I mean, that's one of the most basic designs of the female human body. So it can and will do that. Your body's not going to create something inside your body so large that it can't get out. That just doesn't make any sense to me. So cesarean rates of 1 out of 3 women, you know, can't give birth naturally. That really gets me. And yes, I know some are scheduled and some are around time schedules and this and that, but, you know, if you just sort of adapt and try and work on some of that structural stuff and work on some of the stretches and some of the exercises to just create the flexibility and just have the knowledge that your body and faith that it will birth properly, I mean, that's the most powerful thing. So, is it all going to go ideally? It'd be great if it did, but even if it doesn't, it's really going to go the way it's supposed to be anyway. All right? Any other ones?
Okay, just for my, okay, so we had the one where we brought the leg up and we did the perineum, was that what it was called?
Piriformis.
Piriformis. And then there was the squats, but what was the one in between? What was the others?
You know what? I do have a handout which actually lists all those things,
Okay,
and there's
cool.
a picture on it too, so I'll grab that.
I have some handouts with exercises too.
Okay,
so.
good.
Nurse, I'm also a doula, and like I said too, I'm a childbirth educator and lactation educator. So I have put together a few slides with some exercises and a lot of what you said, but a few other things as well. We organized these pictures. I thought I'd bring my baby just to show a little bit different 3D. So this is what we want, the ideal. We want baby, the back of baby's head is always the reference point. So to the front, but a little bit to the left. And so baby's gonna be sort of curled up like this. This is the ideal. What we don't want, and it causes just more pain and usually a longer labor, is this. So baby's sunny side up or posterior. Back of baby's head is, you know, to mom's backside. So you've got the bones in baby's head coming through right on mom's tailbone. So that usually causes a lot of back labor, back pain during labor, which is why we want baby this way. Baby can be to the right, so baby can be over this way, you know, with the back of the head towards mom's front. But, and I never got a clear answer as to why, but babies are in this position often turn posterior, and then they might go to the left before birth. So again, this is not ideal. It usually ends up being a longer labor as baby makes this long trip around. Every once in a while, baby will turn, you know, the short way around, but for some reason they like to go the long way. Too far. Okay. There's a great website called Spinning Babies, which is where I got most of this information. Spinningbabies.com. So a lot of tips and tricks, and there's much more information on the website that I'm going to cover. So if you want, she gives daily and weekly exercises that you can do. I'm just going to give you a couple basic ones, but definitely go to the website and get even more. But the 3 principles, and Dr. Dowd mentioned this, are balance, gravity, and movement. So we're going to start with balance. Not used to this. So this can be relaxing tight muscles and ligaments, but if you've had a baby or two, it can also be toning loose ones. So there's sort of a balance that you need to reach there. A couple things that can be done as far as relaxing those, you know, tight ones and getting balance. So chiropractic care, of course. A couple other things. Rebozo sifting. So what this does is you get down on your hands and knees, and you need someone to help you do this. You get down like this, and you're just going to let your belly sort of hang, that hammock, and you're letting equally on each side, let baby hang, and just let some gravity work there. And then you need someone to take a scarf or a sheet or towel or something sort of wrap it around your belly, and they're just going to pull back and forth. And just rock baby in that hammock. I've got a picture on the next slide here. So this is what I'm talking about. She's on her hands and knees. She's got a scarf, just letting baby sort of hang in that hammock. And you're just going back and forth. You're just letting those round ligaments relax into there. So then there's the inversion, which is the same thing. You're just letting baby sort of hang in a hammock. Sorry about this slide. This I think is a little difficult. She's up on her couch. So you could do just, your bottom step, or if you have some yoga blocks or something, or a step that you use for aerobics, something that's lower. You just want to get your knees up, your hips up in the air, and then you're just resting on your forearms. Again, you're just letting baby sort of come out and hang. You're letting gravity work a little bit to stretch everything out. Probably feel really good. You don't need to do it any longer than about 30 seconds. It's just very quick there. This, the sifting, you could probably do for a couple of minutes, whatever's comfortable. You'll probably feel baby moving around a little bit as they sort of get some space in there and get comfortable into a good position. And this third picture down here, it's a psoas release. So she is laying down, she's got her feet up, and she's just letting her back relax. Sometimes you get tight back in here. Again, that's something that you're not spending a lot of time on your back, maybe just a couple minutes, whatever's comfortable. Certainly if you're feeling uncomfortable, just get up, but maybe a minute or two on your back. That's something you could do every day. So that's balance. The next one is gravity. So we want to use gravity to help baby get into that good position. Baby's head is the heaviest part, followed by sort of the shoulders, the top of the back. So babies, naturally want to be head down because we spend a lot of time upright, so the heaviest part's going to go down. Then as far as that, going left and right, if your baby is over to the right, or if your baby is sunny side up, posterior, you can help coax them over to the left by using gravity. Very simply, if you're leaning forward or if you're on your hands and knees, baby's gonna fall, this way. So you can do some time on hands and knees. You can use the ball. Just lean on the ball, spend some time like this. That'll get baby to fall so that they're this way. There's a great exercise you can do on your hands and knees called the pelvic tilt. And so you just start with your back sort of flat, and then you're gonna lift up and let your belly hang, and you're just tilting your pelvis. It takes a lot of pressure off your back, sore back, from carrying your belly around all day. So it feels really good. It actually works your abdominal muscles a little bit, what you can while you're pregnant. So it's a great exercise to do. Side lying, which again we talked about a little bit already. And what Sitting Babies recommends is if you can lay on your side, if baby's not to the left, lay on your left side and even tilt your belly down a little bit. So if you think about where your belly button is, so you're laying in bed on your side, even so you're tilted towards the mattress a little bit, keeping everything in line, of course. You're not twisting, but so that your whole body is actually tilted towards the mattress a little bit. That'll get baby to sort of go over to the left. So what you don't want is to be tilted towards the back and having baby flip this way. Get off the couch. So again, you don't want to be slouching in your chair. What is going to work against gravity is sort of the recliner position. You've got your feet up. So comfortable to put your feet up when you're pregnant, I know. But you don't want to spend a lot of time like this because the heaviest part, baby's head and shoulders, is more likely to fall to your back, which is the less than ideal. You want to spend more time sitting up, creating space in the front of your pelvis, so that baby is more comfortable this way. So you can sit on the ball, you can sit forward, keep your knees lower. Don't cross your legs. Cross your legs. What's that?
So the Swedish chair,
Yeah,
right?
the Swedish chair. When you cross your legs, you make a smaller space in the front of your pelvis. You're off balance. Baby's more likely to, they're going to find the space. So. Okay, so movement. Keep all your joints moving. And this could be as simple as just walking, getting some exercise, making sure that everything's moving. Swimming is great because you don't really have all that gravity. The pelvic tilts that I showed you, sitting on the exercise ball. You can sit on the ball. You can also do some circles like this. You can do sort of figure 8.
Those are really good.
That way you're getting a little bit of movement as well as just sitting on the ball. So just to review everything, there's balance, good posture, you're not crossing your legs, having equal on both sides, not carrying the baby, just on the one hip. Gravity, so using the heaviest part of baby, being on your hands and knees, getting baby into that ideal position, and then movement, so keeping everything nice and loose, getting some exercise. Just a picture here of the pelvic tilt exercise. So she's sort of got her back down and then she's pulling up flat. And the last thing I wanted to do was just talk about where is your baby. So, full handout on belly mapping. So certainly your midwife or your doctor can tell you where your baby is, but you can feel too. You can feel where your baby's kicks are, and a lot of times you can figure out where the back is or where baby's bottom is. And they start taking you through step by step. So be aware of movement. So where do you feel a lot of movement? Do you feel a lot of kicks over here, which if your baby's in the ideal position, that's usually what you're feeling, a lot of movement up over here. Are you feeling movement down low as baby, breached? Are you feeling all those kicks down low? So this little square is just, where do you feel that movement? And mark it on there. And it can be different day to day, because babies do move. They might flip from side to side, even day to day, but where do you feel most of that movement? And then feeling for baby's back. So where do you feel something solid versus a little bit more squishy? This side where the movement might feel a bit more squishy, and then you've got one side that feels really solid, like, okay, there's something there, that's probably baby's back. And if you feel a big lump, that's usually baby's bottom. You usually feel like there's a big bump here, or, wherever it is, you can feel for that. So, it takes you through that, the first side there. Hello. And then the second page, they're just showing you, use a doll. So you get out a doll or a stuffed animal or something that you have and sort of hold it in front of you and think, okay, well, if baby was this way or if baby was that way, how would they be in there? Where am I feeling those different parts? So, get out your little doll and sort of figure it out and draw it on there. And then just the last part of the handout tells you sort of those technical terms. Is baby left occiput posterior or anterior? And they're showing you too, the ideal position is that left anterior position. All the others are less than ideal. So they actually put all the others into posterior, even though baby might not necessarily be posterior. They're calling them that because they're less than the ideal. So really want to get that baby over to the left. Any questions about?
And do they say at what point in the pregnancy, like, it's important to have baby in the right position, Because they're gonna be flipping and flopping when they're smaller.
So, you know, on this website, they say even starting like at 10 weeks, start doing some of the exercises and things so that you've got balance and, you know, like Dr. Doug was saying, chiropractic care even throughout your pregnancy is important. Definitely I would say as you're getting into the 3rd trimester, you would want to be doing these things and making sure that, you know, baby's in a good position. If the larger they get, harder for baby to flip around and move. I forget, usually by 28 weeks, babies head down. So you can even start earlier than that, you know, with some exercises and things and get baby to move. Cool. Any other questions?
She's kicking me.
Kicking you down?
Where?
Perfect. Then I just have 2 other handouts.
I
This
only
is
had
some of
one.
those
Very
exercises.
good. I only had one.
You beat it.
I didn't come prepared. Oh, I did put Spinning Babies, the website on the handout too. There's a couple other ones,
Oh.
but that really is a great.
There's
website
so
to
much
check out.
on there. It would take you a long time to read everything, but there's a lot of exercises. And then finally I have one on using a birth ball, and some of these are just things you could do during labor. It's not necessarily things that you have to do ahead of time. But I have some for you too.
Good one.
You have or haven't?
I have.
Yeah. Do you have one at home too?
I don't. I used to, and it was in such a small space. I got rid of it. Now that we moved to the bigger space, I wish I had it back.
Even
what?
post baby,
The exercise
they're
balls.
amazing
Yeah.
because a lot my 2 youngest daughters, a lot of it like when they just want to be held and rocked, Victor will wear them or hold them, and while he'll play a video game, we'll sit there and bounce,
Yeah.
and it's wonderful. They're great.
Careful around your china though.
Oh,
Kids will throw it all over.
I don't have China. I can't have nice things for a while.
I do think a couple, you know, you're mentioning squatting. If you can try to just get it into your normal routine when you're picking up toys or whatever, you know, instead of doing this, which you're not supposed to do anyway, you know, squat down and pick it up so that, you know, it doesn't have to be, all right, I gotta make time so I can practice squatting. No, I mean, just do it when you're getting something out in the low cupboard, you know, squat down like this and get whatever, you know, whatever it is so that you're just incorporating it into your daily activities.
Are you trying to do the 30-day squat challenge?
No,
Did you see that?
No.
I was like, oh, is that in a day or all at once?